The coronavirus continues to impact the nation and our own communities in new ways. Tonight, WTVM News Leader 9 and WXTX Fox 54 present the latest information from informed experts. Our live news special, COVID-19, What You Need to Know Now, starts now. Sponsored by Magnolia Manor Senior Living.
And good evening, everyone. I'm Barbara Gauthier.
I'm Jason Dennis.
And I'm Rosalind Giles.
Tonight, a special program focused on COVID-19, or this strain of the coronavirus.
And for our Fox 54 7 p.m. news viewers, we are simulcasting this program with our WTVM viewers to reach the largest local audience possible.
Now, if you are digital minded, we're making this program available to you via our free WTVM web app and also on our streaming apps.
As you can see, we are practicing social distancing by keeping the recommended amount of space between each other, and we're ready to bring you the latest and most up-to-date information to keep you and your family safe.
Over the next hour, we'll be talking with local experts to address what's on your mind these days, from testing to your financial security, as well as your mental well-being. But first, Rosalind has the latest information from today.
All right, thank you, Jason. And as you know by now, information on COVID-19 comes in fast and furious. We want to make sure we focus on the top local developments, the ones that affect you directly. Here are the latest facts we have on the coronavirus pandemic. The total number of coronavirus cases in Alabama is 68, with 10 in Lee County and 1 in Chambers County. As of today, Alabama officially turned its restaurants into drive-through, pickup and delivery only, closing dining rooms to try and slow the spread of the virus. The total number in Georgia sits at 287, with 1 case in Muskogee County. That Columbus patient being treated at St. Francis Hospital tonight in isolation, and 2 cases in Troup County. While there have been no deaths in Alabama, Georgia has seen 10 people die, with 4 of those coming from the Albany area. And coming up, I'll be talking with Columbus Mayor Skip Henderson about Muskogee County's first confirmed case of the coronavirus as the measures that they are putting in place. Barbara and Jason?
Yeah, these numbers, Rosalind, of course, as we know, changing quickly, and we are keeping up to date on these changing numbers.
And tonight you're going to hear from some of our local experts and see reports from our investigative unit. You know, these resources are available to you 24/7 on a special page dedicated to the coronavirus. It's easy to find, WTVM.com/coronavirus.
Just click the red banner there at the top of the homepage. You can also get this information on our free WTVM mobile app and see programming live or on demand with your favorite streaming device. Now, during this pandemic, your news leader is working to answer questions that you have. Please email us at coronavirus@WTVM.com. We'll connect you with our experts for those answers. If you've been watching our local news coverage, you know that now there is what's called drive-through testing on both sides of the Chattahoochee River. The Columbus Department of Public Health conducting drive-through collections along with Mercy Med on 2nd Avenue.
And the East Alabama Medical Center, they're hosting drive-through sites as well. But so many of you have asked us about how to get tested. We're going to run through those steps for you right now. Step 1, call your doctor. You'll discuss your symptoms. Step 2, they'll determine if you need to be tested. Then thirdly, an appointment will be made for you to get tested. Now, depending on where those tests are or your individual needs, it's likely you'll still go to a drive-through location.
Now, step 4, when you arrive at your scheduled appointment time, they'll ask for your ID. Currently, they are using nasal swabs to get a sample and send away to a lab. Lastly, the lab will analyze your sample and communicate the results with you and your doctor to determine treatment if needed. Whatever you do, they say, just don't show up and ask for a test. And speaking of testing, the Columbus Health Department is teaming up with Mercy Med, the 2 organizations hosting a drive-through style COVID-19 screening and specimen collection. But organizers say there are some stipulations for those who want to be screened at Mercy Med on 2nd Avenue.
If anybody is concerned about possible illness, they'll call the health department. The health department will screen them, and if they screen in positive, they'll send them over to us at a certain timed appointment. At that time, they'll come in, we'll do the testing, and we'll send off to a lab. The results, unfortunately, still take a while, anywhere from 48 to 72 hours.
That number to call, the health department, is at the bottom of your screen, also on WTVM.com. Patients will be asked to remain in isolation after testing until results are available. Follow-up care for patients will be provided by primary care doctors. Again, we have that number at WTVM.com/coronavirus. And coming up later in this hour-long special, we'll speak with a representative from the Columbus Health Department answering your testing questions. Now back over to Rosalind.
All right, thank you, Jason. And earlier today, Columbus officials confirming the city's first coronavirus case. Mayor Skip Henderson is joining us now to talk more about what's being done to prevent COVID-19 from spreading. Good evening to you, Mayor.
Good evening, Rosalind.
Certainly. Thank you so much for joining us. And we are practicing our social distancing right now as he's across the desk for me. Again, thank you for coming. Now, it's no surprise that we had our first case announced today, of course, with the numbers nationally, locally as well, and cases all around Columbus, even in Alabama, happening before that case. But what's being done to address the positive case that is in Muskogee County right now?
Well, one of the first things we're doing is continuing the message. We're trying to make sure that our community understands that this is serious, but at the same time, it's something that we're going to make it through. But we can only make it through if we're all working together. We're supporting DPH. We're having communications with Department of Public Health, both at the state and local level. We're on calls. It seems like all day long. But it's important to stay abreast of the information that's coming down. We continue to point out to our residents that they are actually in charge of how quickly we arrest the spread of this virus. Because if we practice what the CDC and what Department of Public Health has been urging us to do, the distancing, covering your mouth when you cough, stuff your mom taught you when you were 5 that you should remember, washing your hands. And if we're intentional about doing that, then I think we're going to have a dramatic impact on how long this virus is a problem in Muskogee County.
And that's an important point that you bring up, because you have a lot of young people between the age of 20 and 44. Information coming out just today stating that young people are not taking it as serious as they need to.
Well, I vaguely remember that age, but most teenagers and 20-somethings, they think of themselves as invincible. And to a great degree they are. But what's important for them to remember is not to be selfish. Because if they interact with somebody from my generation now, they put their lives at risk. And when they go visit their parents or their grandparents, there's the opportunity for them to unintentionally pass something along that they may not have even known they had.
And we do know that age group represents about 20% of the cases right now in America with COVID-19. But going back to the infected person in Muskogee County, that person has not been identified yet. We do know HIPAA laws do exist that may prevent that. But how are you going to let people know if this person came in contact with anyone in the community? Well,
I do know that, and I think you'll learn more about this when you talk to the rep from the Department of Public Health, but there are mapping requirements. They initiate the practice and process of trying to identify who all came into contact with that individual. We've actually offered up our public safety services from our detective branch if they actually need help helping to track some folks down that may have come into contact with them. But it's an arduous process, and it's one that has to be undertaken to be able to make sure we keep as many people as safe as possible.
And of course, the city is practicing the social distancing as well. Your press conference was closed to the public today, except for members of the media. What else is being done within the city to make sure people stay safe?
Well, you'll see some changes in the council meetings. You'll see us probably restrict access to the public for a time being, at least for the foreseeable future. We have shut down some venues that typically draw larger crowds, public property, to make sure we're not an attractive nuisance and creating an opportunity for folks to invade each other's space. We are beginning to let a very large number of our employees work from home. We are in the process of evaluating which fees and different types of things that are due in April that we can push back another month so that we don't have the crush of people at the government center right now during this critical time.
All right, Mayor, we appreciate you coming in this evening. Such a trying time, but we, of course, will all get through this together.
Yes, ma'am. Thank you.
Back to you guys.
All right, thanks very much, Rosalind. Well, leaders in Phoenix City also talking about important precautions to take to prevent the spread of the novel coronavirus. Right now, no cases in Phoenix City or Russell County, but there are 10 in Lee County.
Mayor Eddie Lowe is encouraging all residents to maintain their social distancing and self-quarantine to protect themselves and reduce the risk of this virus coming to the city. Lowe says although certain city functions are suspended for the time being, he isn't asking stores or restaurants to close at the moment. In addition to Mayor Lowe, Phoenix City Police Chief Ray Smith spoke on what first responders are doing to stay safe because they come into contact with a lot of people on a regular basis.
Yes, one thing that we have encouraged people to do is certainly not call us for a non-emergency issue. If you have to make a report, it's a lot of reports we can take over the phone. Some things that can wait, we encourage you to wait. Certainly crime doesn't stop in emergencies. We still have to respond to crime, and certainly we know that we're going to be going out. But there's a lot of different things. We're asking more questions on the 911 calls, trying to meet people outside their homes versus going inside their homes. Just a number of little small things like that.
Phoenix City also creating a web page to keep the citizens up to date with all the latest information. We'll have that link for you at WTVM.com.
And coming up, we're going to have another guest in studio. Piedmont-Columbus Regional's top nurse will give you some do's and don'ts on navigating through the unfamiliar territory of COVID-19. He's going to answer some viewer questions as well. That is coming up. Stay with us.
And welcome back to our COVID-19 special tonight. Alabama's governor announcing statewide changes today. All restaurants and bars to go to takeout only and no more in-house dining. Also, gatherings of 25 people or more are prohibited, and all beaches in Alabama will be closed. The East Alabama Medical Center also enforcing new restrictions. A no visitors policy went into effect today, and with only a few exceptions, those include pediatrics and level 2 nursery, laboring women, emergency department, and end-of-life circumstances. Again, other than those, visitors are banned from the hospital. And another health sector affected a great deal are nursing homes. Magnolia Manor in Columbus also taking action with additional preventative measures. Those measures include restricting entry to only individuals who need entry, screenings for anyone who enters the facility, requiring everyone to wash their hands following entry, and limiting only canceling activities outside of the facility. I'm going to take you back now to Barbara and Jason.
All right, Roz, thanks. Well, a lot has happened just in the last few days as the virus continues to rise. We've seen positive cases popping up all around Columbus, but today, officials confirming the city's first case of COVID-19.
And joining us now to talk about more about how to protect you and your family is Carrie Burcham, Piedmont-Columbus Regional's Chief Nursing Officer. Thank you so much for joining us.
Thank you.
Well, Carrie, we know that hospitals are running out of supplies, including surgical masks, and that some have resorted to making their own. We want to know what's going on here locally. What are you guys seeing there at Piedmont-Columbus Regional?
Well, I think managing supplies is one of my primary concerns, not only for the protection of the patients, but for the protection of the staff. And we're being very diligent and thoughtful in our emergency management plans to manage our supplies so that we have what we need. Working with the supply chain for Piedmont Healthcare, we've been very fortunate that that supply to date has been managed well.
Mr. Burcham, you know, we're getting a lot of questions about COVID-19 testing. So what can you tell us about the test for coronavirus in Columbus? We were alluded to that, heard that there were maybe about 50 of those at the drive-through test sites earlier today.
Well, there are some drive sites that are popping up. Our guidelines for testing really have not changed from the beginning. In what I've stated in earlier conversations, there is a prescriptive interview process where patients are interviewed and their symptoms are discussed and triaged, and if they qualify for testing within the hospital environment, which would be an acute care patient, we would only test if we were going to admit. The same sort of process would be applied. We work very closely with our partners, which would be the Georgia Department of Health and the CDC, in terms of making sure that we qualify those patients for testing through the screening process. They receive a number, and then they would go to the outside testing center to be tested.
Harry, it seems there's been a lot of talk about this today. It seems many teens and people in their 20s are not adhering to the social distancing based on the video that we're seeing of people at beaches and enjoying spring break. I want to know your thoughts about that and what you are saying to young people out there tonight about this pandemic.
Well, the advice that I'm giving to others is certainly centered around the lessons learned that we've learned from other countries and other cities that are dealing with this virus. Social distancing is key. The virus is transmitted through respiratory droplets, coughing, sneezing. Those body fluids land on surfaces that individuals touch and then have contact with their mouth. So the advice that I would give anyone, young or old, would to be very diligent about the social distancing, 6 feet or greater, not congregating in venues where you've got a lot of density in terms of people that are present and shoulder-to-shoulder contact. And then lastly, good hand washing, very, very good hand washing. And that is the education that I would communicate to anyone about the diligence that would be required in terms of mitigating the transmission of this virus.
And we've gotten some viewer questions in. One of them says that if someone who has had the virus and is cured or recovers, will it be easier for them to catch it again?
Well, that's not really known. The coronavirus is a family of viruses, coronavirus 19 being one of those. Certainly, you can catch the flu again. You can catch coronavirus probably again. Whether the severity would be the same or the ease of catching it again, I don't think is really known at this point.
And I think that is, Carrie, one of the main concerns for a lot of people is just the unknown. Another viewer question concerns, we know the virus is dangerous for the elderly and cancer patients, but what about organ transplant recipients? What's the dangers there?
Well, the guidelines that we've received from CDC and public health are that one of the preventive measures of the disease is to follow the social distancing and the good hand washing and the avoidance of public contact, particularly for individuals that have underlying contributing factors. If you're an organ transplant patient and you're receiving immunosuppressant therapy, you're certainly in a position to have a compromised immune system and should be particularly adherent to these guidelines because you're probably of a greater susceptibility to contracting the virus than perhaps someone that doesn't have those underlying contributing factors.
Some really good information there. Carrie Burcham, Chief Nursing Officer at Piedmont Healthcare Incorporated. Thank you so much for joining us and for your hard work through all this.
All right, thanks
Thank
a lot.
you.
Well, a lot of workers are wondering about the economy now that most jobs are shutting down.
We'll hear from the president on how he hopes to send relief.
Plus, I'll be speaking with a local partner of Townsend Web Management who'll answer your burning questions about the economy. That interview when we come back.
Yep.
Welcome back to our special. Of the thousands of U.S. patients with COVID-19, 2 are now members of Congress. That as Washington grapples with the staggering economic impact from the outbreak.
The president revealing new steps today to help the economy as tens of thousands file for unemployment benefits. ABC's Inez de la Catera is in Washington with the latest.
With the amount of confirmed cases of COVID-19 in the U.S. now surpassing 10,000, the president zeroing in on how to help the economy recover.
When we do get rid of the virus, we're going to be able to just really, I think, go like a rocket. I think the economy is going to be fantastic.
Revealing he is working with the tourism industry.
We will be helping the airline industry. We will be helping the cruise ship industry. We probably will be helping the hotel industry.
And the president adding he would support restricting the ability of companies that receive government support to engage in stock buybacks.
It's very hard to tell them not to, but I would tell them not to.
Even as 2 of their own tested positive for the virus, Republican Mario Diaz-Balart and Democrat Ben McAdams, lawmakers on Capitol Hill are scrambling to pass a $1 trillion stimulus package.
These are urgent discussions. They need to happen at a member level, and they need to happen starting right now.
Our goal is to make sure that no one, no worker, no family, no one loses a paycheck or goes into financial ruin as a result of the coronavirus.
Unemployment numbers are projected to spike, applications for unemployment benefits surging by 70,000 last week. With schools closed, this bus driver in Kansas was laid off.
I'm guessing somewhere between 4,700 and 5,200 bus drivers all of a sudden aren't working.
On Monday, the New York Stock Exchange is temporarily closing its floor. The markets will remain open, but traders will now work remotely from their homes and offices. Inez de la Catera, ABC News, Washington.
And local businesses need your help to stay afloat during this coronavirus chaos. One way to help is by shopping locally. We all need groceries, and one Smith Station store has been providing them for more than 50 years.
Yeah, Terry's has meat trucks coming in 6 days a week with other items coming in about 3 days a week. You can see what was a full shelf this morning may quickly dwindle, but the owners say shopping for groceries locally can really give back to your community.
Well, when you shop here, you're supporting your community. You're putting it right back into the community. It's not going to New York City or California or anywhere. It's coming right here, so we put it right back into the community. By shopping local, you're kind of keeping the local community going.
Terry says he's staying open amidst the coronavirus chaos, and they are located in Smith Station. You are watching our coronavirus special report tonight. We're going to send things now over to Rosalind.
All right, thank you, Barbara. Watching your wallet, something just about everybody's mind as coronavirus concerns continue to dominate news headlines. Managing partner of Townsend Wealth Management here in Columbus, Tyler Townsend, is here with us, and he has some advice for us during these tough economic times. Good evening, Mr. Townsend.
Hi, thank you for having me.
Certainly, our pleasure. There's been a lot of talk about relief checks. Many Americans are hoping to get two $1,000 checks, one in April and the second one in May. As it stands right now, around April 6th, the first check, we're told, would be $1,000 per person and $500 per child, or $3,000 for a family of 4. And if we are still under a national state of emergency, a second check would go out around mid-May. What are your thoughts?
Well, I think that can be helpful to a lot of people. The advice we're giving is if you do receive that check, then to hold on to it. Don't do anything right away. Don't treat it as a holiday bonus. Don't treat it as extra money. Just assume that you're going to need it for something important. It may be rent, it may be groceries, it may be an office visit for you or for a loved one. So we're asking people to treat that money as a true emergency fund.
True emergency fund, so don't go out and spend it right away just on enjoyment money.
That's right.
All right. And we've heard that the Federal Reserve has technically reduced the interest rate to 0. What does that mean for the average person?
Yeah, for the average person, it can present some opportunities. So anybody that is looking to purchase a home or to refinance a home, it could provide a lower interest rate mortgage, which over the life of their loan may allow them to buy that home for less interest. And then a less direct impact could be that one of the reasons for lowering the interest rate is because it allows businesses to operate more efficiently and pay payroll for a little bit longer. So it can help employees in that way.
Let's talk about refinancing for a moment. Typically, if you refinance your home and if you don't actually pay for your closing costs out of pocket, then sometimes you don't see a big difference in your principal, depending on the interest rates. But with the interest rates being so low, is it a good